I'm Dr. LaDonna Hendricks with Pure Joy Pediatrics, and today's informational talk is about ADHD. So what is ADHD? ADHD stands for Attention Deficit and Hyperactivity Disorder. It's basically a syndrome of inattention and/or hyperactivity/impulsivity, which is persistent and is not developmentally appropriate for the child. There's basically three subtypes. There's inattentive, which is basically the child who doesn't cause a disruption to the classroom, but may be staring off and out the window or sitting in the corner daydreaming, but basically is not paying attention. Of course, the second type is the one that we're more familiar with, which is the hyperactive or impulsive type. This is the kid who's difficult to control, maybe in the classroom or at home as well, and doesn't follow instructions and tends to be doing other activities instead of what they've been assigned to do. And then of course the third subtype is combined. So what do we know about ADHD, and how do we know that a child has ADHD? Basically, there's a set of 9 behaviors that has been classified through our psychiatric handbooks, and a child with ADHD typically has 6 out of 9 of those behaviors. They typically have symptoms that have begun before the age of 7 years old, which persist at least 6 months in duration, and their behavior is maladaptive and inconsistent with their developmental level. The dysfunction is usually present in more than one setting, for example, school and home, school and church, things of that nature. And also the behavior causes significant impairment in social, academic, or occupational functioning. So who has it? Well, statistically, 3 to 7% of school-age children have the diagnosis of ADHD. It's 3 to 4 times more common in males, and females are more likely to have the inattentive type as opposed to the hyperactive or impulsive type. So who's at risk? The risk of ADHD in first-degree relatives is about 25%, so there is some family association with ADHD. Also, children who have other conditions like learning disorders, previous school failures, tic disorder, oppositional defiant disorder, conduct disorder, anxiety, depression, or poor peer or family relations are also children who are at risk for having the diagnosis of ADHD. So what else could it be? There's a number of things that could present as ADHD. But some of the more common things that present with the same type of behavior include vision and hearing problems, sleep disorder, thyroid disorder, lead toxicity, learning disability, chaotic family environment, and even giftedness. Sometimes gifted children present the exact same way because they're bored with the material that's being presented. Those kids oftentimes need more challenges at home if the school environment is not able to accommodate them. So how is ADHD usually treated? Typically, it's a combination of educational support, behavior modification and counseling, and medication, which is usually a stimulant, like the more commonly known Ritalin. So what may be needed from the school? If your child is having difficulty in school, one of the important first steps is getting an IEP evaluation. IEP stands for Individualized Education Program. Other things that may be helpful from the school is proper placement, which typically takes place after the IEP. Smaller teacher-to-student ratio in the classroom, which obviously in some cases school districts may not be able to accommodate. Good communication between the school and home. And also having your child keep a homework log, which is monitored by both the parent and the teacher. What can you do as a parent? Well, first thing is that you can accept your child's limitations and provide support to them. You can provide an outlet for them for excess energy. Just think about the things they commonly like to do, like playing sports or singing, dancing, whatever the case may be, to get rid of some of that excess energy. Develop and follow a structured daily routine. Make sure your child gets plenty of rest. Stretch their attention span. Challenge them to do things where they need to sit longer and pay attention for longer periods of time. Give your child a balanced, healthy diet. And last but certainly not least, work with your child's teachers and your child's regular doctor to come up with a plan that fits. So that's basically the gist of ADHD. If you would like other topics discussed, please email me at doc@purejoypediatrics.com. If you have specific questions about your child, please talk to their regular doctor or schedule an appointment at Purejoy Pediatrics by going to www.purejoypediatrics.com and going to the patient portal to set up an account. You can also call the office at 248-220-2384. Have a great day.